In today's listening session, we will discuss an essential life-saving medical device used in emergency and critical care settings, namely the defibrillator. This device plays a crucial role in restoring normal heart rhythm during life-threatening cardiac arrhythmias, particularly ventricular fibrillation and pulseless ventricular tachycardia. A defibrillator is a medical device designed to deliver a controlled electrical shock to the heart. The purpose of this electrical shock is to stop chaotic electrical activity in the heart and allow the heart's natural pacemaker to re-establish a normal rhythm. Defibrillators are commonly used in emergency departments, intensive care units, operating rooms, and even public spaces. There are several types of defibrillators used in healthcare settings. The most basic type is the manual defibrillator, which requires trained medical personnel to interpret the electrocardiogram, or ECG, and decide when to deliver a shock. Another type is the automated external defibrillator, or AED, which is designed for use by non-medical personnel. AEDs analyze the heart rhythm automatically and guide the user with voice instructions. More advanced devices include implantable cardioverter defibrillators, or ICDs, which are surgically placed inside the patient's body. However, in this session, our focus will be on external defibrillators commonly handled and maintained by electromedical technicians. The basic working principle of a defibrillator involves delivering a high-energy electrical pulse through the chest wall to the heart. This energy depolarizes a large portion of the heart muscle simultaneously. When the electrical shock stops, the heart's natural conduction system can regain control and generate a coordinated heartbeat. Defibrillators consist of several key components, including a power supply, charging circuit, capacitor, control system, electrodes or paddles, and a display unit. The capacitor stores electrical energy and releases it rapidly during defibrillation. Modern defibrillators allow users to select energy levels depending on clinical guidelines and patient conditions. Proper electrode placement is essential for effective defibrillation. Electrodes are usually placed on the patient's chest in an anterolateral or anteroposterior position. Good skin contact is required to reduce impedance and ensure that sufficient energy reaches the heart. Poor electrode contact can result in ineffective shocks or skin burns. Safety is a critical aspect of defibrillator usage. Before delivering a shock, operators must ensure that no one is touching the patient or the bed. This is why verbal warnings such as "clear" are used. Failure to follow safety procedures may result in accidental electrical shock to healthcare providers. Electrical safety features are built into modern defibrillators to minimize risk. These include insulation, controlled energy delivery, and automatic discharge of stored energy when the device is turned off. Defibrillators are also designed to comply with international medical electrical safety standards. From a clinical perspective, defibrillators are used only for specific cardiac rhythms. They are not effective for asystole, commonly known as flatline. Therefore, rhythm recognition is essential. Manual defibrillators require trained clinicians to interpret ECG waveforms, while AEDs perform rhythm analysis automatically. For electromedical technicians, maintenance and testing of defibrillators are vital responsibilities. Routine maintenance includes visual inspection, battery checks, electrode condition assessment, and verification of charging and discharge functions. Batteries must be fully charged and replaced according to manufacturer recommendations. Performance testing often involves using a defibrillator analyzer to measure delivered energy, charging time, and synchronization accuracy. These tests ensure that the defibrillator delivers the correct amount of energy within acceptable tolerances. Failure to meet specifications can compromise patient safety. Calibration is another important task. Over time, components such as capacitors and sensors may drift from their original settings. Regular calibration helps maintain accuracy and compliance with regulatory standards. Maintenance records must be documented carefully as part of hospital equipment management systems. Common defibrillator problems include battery degradation, damaged cables, faulty electrodes, and charging circuit failure. In emergency situations, such faults can delay treatment or render the device unusable. This is why preventive maintenance is more effective than corrective maintenance. Human factors also play a role in defibrillator-related incidents. Incorrect energy selection, poor electrode placement, or misunderstanding device prompts can lead to ineffective treatment. Technicians may assist by providing training, user guidance, and clear labeling of devices. In modern hospitals, defibrillators are often integrated with monitoring systems. Some devices can record ECG data and event logs, which are useful for clinical review and legal documentation. Technicians must ensure that software updates and data storage functions operate correctly. In conclusion, defibrillators are critical emergency devices designed to restore normal heart rhythm during cardiac arrest. Understanding their operating principles, safe usage, and maintenance requirements is essential for students of electromedical technology. As future professionals, your role in ensuring that defibrillators are reliable, safe, and ready for use can directly impact patient survival. Thank you for listening. I hope this session has enhanced your understanding of defibrillator usage, safety, and maintenance in clinical environments. Answer the multiple-choice questions based on the tape. 1. What is the main purpose of a defibrillator? A. To monitor blood pressure. B. To deliver oxygen to the lungs. C. To restore normal heart rhythm. D. To record body temperature. 2. Defibrillators are primarily used to treat A. Hypertension. B. Respiratory failure. C. Life-threatening cardiac arrhythmias. D. Brain injuries. 3. Which cardiac rhythms are mentioned as indications for defibrillation? A. Asystole and atrial flutter. B. Ventricular fibrillation and pulseless ventricular tachycardia. C. Sinus rhythm and bradycardia. D. Atrial fibrillation and heart block. 4. What is the main difference between a manual defibrillator and an AED? A. Manual defibrillators are portable. B. AEDs require ECG interpretation by doctors. C. Manual defibrillators require trained personnel to decide on shocks. D. AEDs deliver higher energy levels. 5. AEDs are designed mainly for use by A. Cardiologists only. B. Biomedical engineers. C. Non-medical personnel. D. ICU nurses only. 6. The basic working principle of a defibrillator is to A. Stimulate heart muscle continuously. B. Deliver a high-energy electrical pulse to depolarize the heart. C. Increase blood pressure. D. Cool down the heart. 7. Which component stores electrical energy before it is delivered? A. Battery. B. Control panel. C. Capacitor. D. Electrode. 8. Why is proper electrode placement important? A. To reduce charging time. B. To improve screen visibility. C. To ensure effective energy delivery to the heart. D. To increase battery life. 9. What verbal warning is commonly used before delivering a shock? A. Ready. B. Standby. C. Clear. D. Emergency. 10. Why is defibrillation not effective for asystole? A. The energy level is too low. B. There is no chaotic electrical activity to stop. C. Electrodes cannot detect the rhythm. D. Batteries discharge too quickly. 11. Which task is part of routine defibrillator maintenance? A. Adjusting patient medication. B. Checking battery condition. C. Interpreting ECG results. D. Performing CPR. 12. What tool is used to test delivered energy and charging time? A. Multimeter. B. ECG monitor. C. Defibrillator analyzer. D. Oscilloscope. 13. Why is calibration necessary for defibrillators? A. To reduce alarm sounds. B. To improve cosmetic appearance. C. To maintain accuracy over time. D. To shorten charging duration. 14. Which problem can occur if preventive maintenance is neglected? A. Improved device performance. B. Delayed or ineffective shock delivery. C. Reduced need for training. D. Increased patient comfort. 15. According to the tape, what is one role of electromedical technicians? A. Diagnosing cardiac diseases. B. Performing heart surgery. C. Ensuring defibrillators are safe and ready for use. D. Prescribing emergency drugs.